Hello, my name is Paul Kroner. I'm currently a second-year GI fellow at Mayo Clinic in Florida, and I took Mark's workshop in 2017 with a whole bunch of the New York crew. Ever since, I've produced over 200 abstracts myself as a first author. And Mark asked me to talk to you a little bit about how the topic selection worked given the high volumes of work that I've produced so far. So in order to talk a little bit about how the ideas come about, we need to start talking about what research really is. And to me, this is the first question that I ask myself, because research is essentially asking yourself a question, but it is a question that is actually worth answering. Because if the question that you're asking yourself is not worth answering, then you're out in first base. And I try and standardize everything that I do, even the research questions in itself, and think about what the structure of a question might look like. The structure of a research question does have certain parameters that need to be met. I mean, you can look at it in certain different ways. What I use myself to do this is the PICO format. PICO stands for population, intervention, comparison, and outcome. If you fulfill each of those four factors, you've got yourself a question. Obviously, that's worth answering. Now, for example, you can do these types of questions in either NIS world or non-NIS world. For example, if you would like to look at it in the non-NIS world, you can look for a population, say, patients with C. diff infection. The intervention can be vancomycin orally. Comparison can be Flagyl, and outcome can be hospital length of stay. That's one way of looking at it. But if you'd really like to extrapolate this into the NIS world, then you can potentially select a population being, for example, patients with cirrhosis. That's your P. Your I, intervention, patient with acute pancreatitis. Your comparison, patients without acute pancreatitis. And the outcome can be inpatient mortality. So then you got yourself a PICO question in the NIS realm. And you can play around with variables however you want in order to get multiple questions dealing with multiple entities. I mean, you can even substitute the term cirrhosis or the ICD-9/10 code for cirrhosis and change it for Crohn's disease, for myocardial infarction, for hypothyroidism. Like anything that you want is possible as long as you're following your PICO format of questions. So now that we've talked a little bit about what the PICO format comprises, let's talk a little bit about how can we make this relevant clinically for you. And to me, there are three ways in which we can do this. Number one, for instance, when you're rounding in your everyday medical life, people ask questions during rounds. Your attending asks something, or some of your colleagues ask, what is the association between this disease and that disease, or between this disease and the outcomes if you had this third factor coming into play? And sometimes the answer is we don't know because there's no evidence. And that's your opportunity to say, like, hey, can this idea potentially be dug up with large database analysis? And that's when you take up your notepad, you write down this idea, and you relax at home, you look a little bit deeper into that idea. Always keep that notepad in handy. To me, I mean, I keep it even in non-clinical settings, even when I'm laying down in bed at night. I take it out and like thinking about an idea, write it down. If you don't think about it and you don't remember it, and you don't write it down, it'll be lost forever. Now, number two, the second way in which we can make this clinically relevant and get ideas out there in that way is during national conferences or any sort of constructive criticism that your work is getting. For instance, if you're presenting at a national conference a paper on XYZ condition, someone comes along and provides better ways in which you can improve this, or alternatively, suggests a different subject that can be done. It happened to me. For instance, I was presenting a poster on liver transplant and the effect of BMI on the outcomes after liver transplantation. And this person came up to me, asked some questions, kind of formulated things in which my project could get better. And at the end, he asked, hey, can you do the same thing for Wilson's disease? Yeah, as long as it has an ICD-9 code or ICD-10 code, you can go for it. And I even asked him further, said like, hey, but would you like to be the senior author on this work? I'd love to. And he took out a business card and he gave it to me. Turned out to be the world guru on the Wilson's disease, and I ended up working with him on this awesome project. And the third way in which you can come about into getting this to be clinically relevant is looking up the existing literature online. Of course, you need to use reliable sources, PubMed, and there's an HCUP publication finder online, which will be providing the link in the description below. And as long as you're looking and browsing through these subjects, maybe someone else did a similar kind of idea in the methods that you want to do, but with an uninteresting condition, not applied to your field of interest. Say they did a nice methodology for a cardiology paper, and you're actually interested in GI. You can take that methodology as well and get ideas on how to get around those kinds of things. Someone else might have done something similar in the methods, but you can apply it to your field of interest. So in essence, this is how I select my topics for creating NIS projects. I hope you find it useful and you can apply to your practice. And congratulations on finishing the workshop. Now it's your turn.